Hi, and welcome to our RCA Lessons Learned series. Today's root cause analysis case study overview will be about a patient who broke her hip as a result of falling at home after taking her prescribed nortriptyline. The sourced article is below, and I'd like to thank Dr. David Benjamin for his assistance with developing this case study. Let's proceed. Here's the case background. A 68-year-old female in good health is seen by her family physician following the death of her husband. The patient reports feelings of loneliness, difficulty concentrating, sleep disturbances, decreased appetite, and generalized feelings of depression. The physician decides to try the patient on a short course of tricyclic antidepressant medication and prescribes nortriptyline 75 milligrams at bedtime. The physician instructs the patient not to get out of bed too quickly in the morning and to sit on the side of the bed for a few minutes before attempting to stand up. A few days later, the patient is lying on a chaise lounge by her swimming pool, enjoying the sun. She decides to check her mailbox. After a few steps, she gets dizzy and falls on the concrete apron surrounding the pool, breaking her hip. It was determined by the medical staff that a need for a formal analysis to uncover the root causes of this incident be conducted at the time. So let's go ahead and look at our case study. We're going to explore this case study using what we call a logic tree. There's a legend off to the left that will describe any icons that may be foreign to you. We're going to start with the event, or the E. The patient breaks the hip. This is a fact. We will ask, how did the patient break her hip? She became dizzy from an adverse reaction to a medication and she fell. These are cause and effect relationships as we move backwards in time. The M in this case is the mode. Now, we don't understand from this point about the details of exactly what happened, so we become hypothetical. We ask, how could? So how could the patient have become dizzy from an adverse reaction to a medication and fell? The possibilities are taking the wrong type of medication, taking the wrong doses of a medication, known medication side effects, or mixing medication with alcohol or other medications. Please note the number in the lower left-hand corner of each of the hypotheses. This is called a confidence factor. It's based on a scale of 0 to 5. 5 means with the evidence that we have, this is absolutely true. A 0 means with the evidence that we have, this is absolutely not true. So we're exploring all possibilities. Now in this case, we want to be able to note here that this is not just based on hearsay, but this has a factual evidence basis. This is called a verification log. In this verification log, we will have to cite a verification method. In this case, we're going to look at the potential side effects of the nortriptyline and see if it can cause dizziness. We're going to assign it to this person based on this date, and the outcome is nortriptyline can cause dizziness due to postural changes at any time triggering orthostatic hypotension, especially at the initiation of treatment or following a recent dose increase. Okay, so knowing that this is going to be true now, what we're going to do is to continue down our logic tree. We only want to follow what we want other people to follow that we're presenting this to. So what we're going to do is collapse this, and we're going to say, how could the known medication side effects have been in effect and still allow this fall to occur? The patient did not follow the warnings regarding the medication side effects. Notice we've put labels on here. The PR is a physical root cause. This is the first observable consequence after a decision error. The human root is that decision error. So we want to say, at this point, we switch our questioning from how can to why, because we're at a point where a person made a decision. So what we'll do is say, why did the patient not follow the warnings regarding the medication, of the side effects of the medication? And notice now, the patient did not read the patient information brochure provided with the bottle. The physician neglected to provide adequate warning to the patient. The patient forgot the warnings provided by the physician, and the patient did not ask for counseling from the pharmacist. Now notice here that we have a 5 in one block and we have 3s on the other. With the evidence provided in this case per the investigation, it was certain that the physician neglected to provide adequate warning to the patient. However, there was not enough evidence to substantiate one way or another these other 3 possibilities about the patient not reading the information that was given to them, the patient forgetting what the physician told them, nor do we have any information regarding that the patient actually did decline the counseling opportunity with the pharmacist. So we're going to leave those at that right now as being unsubstantiated, but we will follow the physician neglected to provide adequate warning to the patient, and we continue with asking why. The instruction by the physician was not comprehensive enough. Day versus night. The instructions to the patient were about getting up quickly from bed, sitting for a few minutes, and then getting up to a standing position. However, the instructions did not say that that could be at any point in the day, from the point you're getting up out of a chair, at any point in the day, to a sitting position, to a standing position. Generally, the poor communication skills by physicians make it difficult for them to communicate in layman's terms to the patients. And it was a low priority by the physicians because the higher priority items are making diagnoses and writing prescriptions. So given this logic tree, we can go to showing the path to failure, and these LRs are latent roots. Latent roots are systemic issues that contribute to a decision error. And based on that decision error, we trigger a series of physical consequences until the point that we have an undesirable outcome. Let's get back to our overview of our RCA findings now. The root causes of this incident can be directly attributed to the lack of clarity to the warnings provided by the physician or a learned intermediary. This is a person who's in between the pharmaceutical manufacturers and the patient. It is their duty to provide these warnings to the patient on behalf of the side effects of the medication. The length of the patient information brochures and the difficulty a patient would have recalling all of this information that's conveyed to them. Let's look at the keys to informed consent. They are material and reasonably foreseeable. Material meaning is of consequence. Reasonably foreseeable is likely to occur as evidenced by its frequency of occurrence and presence in the package insert or in other respected medical or pharmacology textbooks. Let's go through an example of material and reasonable. We talked about the instruction about getting out of bed. When we're in a laying position, our blood pressure might be normal at 120/80. If we get up to a sitting position too quickly, our blood pressure may drop to about 100/60. And moving from a sitting position to a standing position, our blood pressure may drop farther, 80/40, which could easily allow us a fall. This is material and it's reasonably foreseeable. Recommendations. Physicians should clearly explain the material, foreseeable side effects of prescribed medications and at a minimum provide the following information: the name of the proposed treatment or procedure, a description of the anticipated benefits, a disclosure of appropriate alternative procedures or courses of treatment, if any, that might be advantageous, any foreseeable risks should the patient become pregnant. They should ask the patient to repeat any special or critical instructions so that we have a clear understanding that they understood the message that we communicated to them. And we want to ask the patient if he or she has any questions. For more information on this case or the RCA approach used to express it, please visit www.reliability.com. For access to the feature article highlighting this case, please click below, and this will take you to a website by the publisher where you can purchase this particular article. I thank you for your time, and we hope to see you again in the future. Take care.